Angiogram of left coronary system of 35 years old male who presented with the CAD SCS inferior wall STEMI. So you can see the LCX and LAD in this RAO caudal view, and this is a right coronary artery angiogram. You can see there's a non-dominant RCA, thin vessels. So that means this patient presented with a ST elevation MI and inferior leads. So RC is non-dominant, so LCX should be dominant. So as you can see, there's a stump in the LCX, distal LCX after the OM. So here there is a stump near the arrow in the LCX. So wire was put in this distal LCX, and you can see there is a thrombus. There's only 6 hours index window period was. So patient presented in the 6 hours only. So this is a sort of primary PCI. So you can see the thrombus in the distal LCX. In this caudal view, we can see there's a thrombus in the LCX. LCX distal got opened up while putting the wire, and you can see there's a thrombus. So we did the thrombosuction in this patient with the aluminate catheter. So you can see this distal L6 got opened, and this is a yellow cranial view. We can see the wire is in the distal L6, which was invisible because of the stump in the LCX before. You can see now the distal L6 also. So after balloon dilatation and thrombosuction, it got nicely opened, distal LCX. Let's see the other view. So LCX nicely opened up. In this view we can see then the distal part of distal LCX stented with 2.5 into 32 stent. So this was the cranial view while deploying the stent. So again, this is caudal view while deploying the stent. Then after the bifurcation, just where there was a lesion and stump, in that part we deployed the stent. You can see before the bifurcation also, and just in that part stented. So this was the deployment. So you can see the cine after the deployment of the stent and the overlapping of the stent done. So proximal stent diameter was 3 into 32, overlapping of stent done in the distal part of LCX. So you can see how nicely the distal LCX has got opened up, and it is a dominant LCX, dominant left system. This is the caudal view, and this is the cranial view. We can see how dominant the LCX is. So this was the caudal view we can see before the angioplasty. You cannot see the distal LCX. There is a stump. It's hard to recognize there is a stump. And after angioplasty, this is after angioplasty. You can see how nicely it has opened up. So this was the sort of primary PCI, and done the thrombosuction also.